Next, we'll be talking about ocular diagnostic drugs. There are quite a few medications or drugs which are used in ophthalmology for diagnostic purposes. The most common one being the fluorescein dye. These fluorescein dye is available as eye drops or fluorescein strips. So what are the uses? It is used to stain corneal aberrations, as you can see in this picture here. This is the fluorescein strip which is used. It is used for applanation tonometry. Just after instilling topical anesthetic, we have to stain the cornea with fluorescein strip and then perform the tonometry. It's also used for detecting wound leak after cataract surgery, which is called as the Seidels test. It's also used to identify any nasolacrimal duct obstruction. It's also used in fluorescein angiography. This is a picture showing a fundus fluorescein angiography. After the fluorescein dye has been injected, it spreads in the retinal circulation, and it is used in quite a few retinal conditions as a diagnostic tool. So these are all list of indications of fluorescein dye. The other drugs are rose bengal stain, which stains devitalized epithelium, which you can see here. It is used in severe dry eye and herpetic keratitis. Next drug is local anesthetics, which is used just prior to any ocular procedure that we are doing. It again is either topical or local. The topical local anesthetics include proparacaine, which is available as 0.5% drops, which is the commonest topical anesthetic that we use. And you have lignocaine, which is available as 4% drops. Again, this is used for applanation tonometry, gonioscopy, removal of any corneal foreign body, removal of sutures, examination of patients who cannot open the eyes because of pain. In patients where there is severe photophobia, you can use these drops and examine the patient. But the adverse effects are it can be toxic to the corneal epithelium, and occasionally it can cause some allergic reactions. Local injections are available as orbital infiltration. Again, I have spoken about these two routes, the peribulbar or retrobulbar blocks. So here we inject a combination of lignocaine with the bupivacaine, and we inject it inside the retrobulbar or the peribulbar space. It causes anesthesia and akinesia, which is required for ocular surgery. The injectable dose of lignocaine is 2%. In the previous slide, we saw that lignocaine 4% is used as a topical anesthesia. So that is something we need to know. Bupivacaine injectable is available as 0.5% solution. So that is what is used. The other medications include lubricants, which are one of the most common medications which are used for dry eye. They are available as eye drops or eye ointments. They include polyvinyl alcohol, cellulose, or methyl cellulose. They are usually available as preservative free, or some of them have preservatives like benzalkonium chloride. Next, we'll be talking about viscoelastic substances, which are an important component of modern eye surgeries. What are the properties of viscoelastic substances? They should be chemically inert, they should be free from any particulate matter, they should be non-toxic, non-antigenic, and sterile. They need to be optically clear so that we have a good view of the surgery that we are performing. The viscosity should be sufficient to provide space for manipulation inside the eye. This is one of the most important properties of a viscoelastic substance. They should be hydrophilic and dilutable, and they should be able to protect the corneal endothelium. So these are the list of properties of viscoelastic substance. What are the common preparations which are available? One of the most common one is methyl cellulose, which is available as a 2% HPMC. Next one is sodium hyaluronate, which is available as Helon 1 and 5%. It is highly viscoelastic and is said to be non-inflammatory. The other one is hypromellose, Chondroitin sulfate is another high viscosity viscoelastic substance which is similar to hyaluronate. Uh, there is a viscoelastic substance called viscoat, which is very commonly used in ocular surgeries. It is a combination of 1:3 mixture of 4% chondroitin sulfate and 3% sodium hyaluronate. So these are the common viscoelastic substances which are used. What are the indications? Why do we need to use viscoelastic substances? The most important indication is to maintain the anterior chamber while performing cataract surgery so that there is space inside the eye. It also helps to protect the corneal endothelium while performing a cataract surgery. It also helps in coating the intraocular lens when we are putting the intraocular lens inside the capsular bag. The other uses are it is used in glaucoma surgery, keratoplasty, retinal detachment surgery, and it is also used for globe repair. Last topic is vitreous substitutes. Vitreous substitutes are also called as tamponating agents. They are usually used after performing a vitreoretinal surgery to restore intraocular pressure and also to provide intraocular tamponade. They should have a high surface tension, they should be optically clear and biologically inert. So after we do a vitrectomy, the space which is created is to be replaced by these vitreous substitutes. So what are the commonest ones which are available? Air is not used that frequently. It is used in uncomplicated cases and it is absorbed in 3 days. Next is ringer lactate or balanced salt solution. It is used after vitrectomy for endophthalmitis and vitreous hemorrhage. Expanding gases, these are pretty commonly used. They are used as 40% mixture with air. Under that, we have sulfur hexafluoride, which usually doubles and it usually lasts up to 10 days. Next is perfluoropropane, which usually quadruples and it usually lasts for 28 days. Next is perfluorocarbon liquids, which is used for removal of a dropped nucleus or IOL from the vitreous cavity. It is also used to unfold a giant retinal tear. It is also used to stabilize the posterior retina during peeling of a retinal membrane. So these are common indications for PFCLs. And lastly, you have the silicone oil, which is used for a prolonged intraocular tamponade, which is most commonly used after retinal detachment surgery, where you need the retina to be attached for quite a long period of time. Thank you.